Brad Hall here from Fenix Physical Therapy. We have another home exercise education for you guys today. This is a technique called Tack and Floss. This is one that we use to increase tissue mobility, and also it's a form of blood flow restriction. Today I'm going to show you how it works primarily distal to the knee or below the knee. This is great for calf and ankle injuries. So super simple. What you're going to do, putting your foot in like a 90-degree knee bend position. What we want to do is you're going to take the first wrap of this Tack and Floss band and you're going to begin just above the ankle. The first one is just kind of a placeholder. This is going to be a spot where it can hold the band down. After that, what we're going to do is we're going to wrap this band progressively up the calf. The way that we measure intensity on this one is that you're going to take the resting length of this band and you're going to double that length and you're going to wrap it. So what's going to happen is as you double that length and wrap, it's going to compress that muscle tissue. So the reason that we call this tack and floss is that as you pull through, this is tacking down or securing all of the muscle tissue, skin, nerves, lymphatic vessels, anything that's present in that tissue is going to be experiencing a pretty substantial compressive force. Once that tissue is tacked down, the concept is we can do this all the way up the calf. But what you're going to do is once that's in place, you tuck that band underneath, and there's two ways you can do this. The first one is that you can just create active motion, just a calf raise. That's the floss. So once you've tacked that tissue down, flossing the muscle fibers through that band allows for what's called the transverse fibers. Anything that would connect those muscle fibers is going to help break those apart. It increases tissue mobility and it also promotes healing. The second version is you can get in a traditional runner stretch, putting that knee back and creating tension force in a calf stretch with the leg straight or with the knee bent. So these are great stretches and mobilities that are going to help for tissue healing. It's also very productive when we're trying to promote more cellular activity. We know that ligaments and tendons many times have injuries because they're undervascular. They don't get enough blood flow. This is one that in the time being, as it creates that disturbance and as it modifies blood flow, when the band comes off, cellular activity and circulation increases. So this is a home exercise program, Tack and Floss. It's one that we love. If you have any questions, make sure you reach out to us. This one's super important as it pertains to safety. Do not leave that band on for more than 2 minutes at a time because of the occlusion of blood flow. If you have any questions, let us know. Thanks for logging in.